Okay. All right, so welcome everybody and congratulations on making it here. I know it's a long time coming sometimes. It's a hard wait for those letters, but you got in, so yay. So today we're going to go through a whole bunch of information about what you need to do to start before you start the program. And I'm going to share my screen. I have a PowerPoint for you that we'll go through. So this kind of goes along with the packet that you should have received in the mail. So you're not allowed to start the program until you have all this paperwork completed. We need all these things for hospital records and accreditation and that kind of information. So you have to have all of your paperwork completed before you start the program. If you got a letter that said we need a transcript, a high school transcript or whatever, and you think, even if you think that you have already sent it to us and we don't have it, then, or that letter says that we don't have it, check with us and make sure that we got that, okay? If it needs to be sent, then have that sent to the nursing office. So there's some important things to know about our curriculum, and we'll kind of talk a little bit about that. So your first semester, you're going to have 3 nursing classes. The first one is Nursing 170, which is kind of your fundamentals nursing course. You'll have class on Monday and Friday mornings, and it has 1 6-hour day of clinical a week. 171 is nursing applications. That's a skills class that you use. You learn all the skills that you need for the program. All right, that's 1 3-hour block a week. 160 is the health assessment, and that's also a 3-hour class. Okay, the applications and health assessment take place usually on Mondays and Tuesdays. Okay, and there's usually flip-flop. You go to one and then you go to the other one. Okay. Now the important part of it that sometimes people, get messed up with is the A&P1 and Human Development and Child Psych. A&P1 has to be taken either first semester or before. Okay, you have to have A&P1 before you go on to second semester. Human Development or Child Psych, you have to take the first semester or be done beforehand. Again, that one has to be done before second semester. Okay, so if you still need those courses, you have to sign up with those for the fall. In second semester, you have 172, which is Concepts of Management 2. This course meets on Tuesday and Friday mornings. It is basic med-surg and mental health concepts. And then there's a pharmacology class that goes along with that meets 1 hour a week on Fridays. A&P2 and microbiology must be taken before third semester, so you have to have them before first semester or with second semester, or there's a summer option, whatever that may be, however your program works out. But it has to be done before you can go into third semester. Third semester is Management and Concept 3. This is med-surg concepts and maternal child. And there's a pharmacology class that goes with that. That meets on 1 hour on Friday. The 270 class meets on Mondays and Friday mornings. If you haven't had English 1 already, you'll have that class, and sociology if you haven't had it already. Fourth semester is Nursing Concepts and Management 4. It's complex med-surg concepts. So community health and intensive care kind of concepts. Humanities course if you don't have it already. And English 132 or speech to graduate from the program. So you see in your packet there's a checklist, and these are some of the papers that you need to, it'll list out all the papers that you need to have for the program. Okay, so you can make sure you have everything done when you turn your packet in. And you'll see there's some options to turn it in, and Ms. Semrick will talk about that a little bit more when she logs on in a little bit. But there's some ways to turn that into her. You'll see some of the papers can be due August the 9th, okay? But do not start, there's some information on the bottom of the paper that has to be started after May 17th, okay? Everything's due August 9th, but some of it can't be started until May 17th. I do that so it's good for the whole semester. So it's some CPR, background check, drug screening, TB test, those kind of things. So you have those done for the whole semester. So we'll talk about that. We have it also in calendar format so that you can have a look at that. Sometimes people keep it straight in a calendar format. Now, if we told you you needed any prerequisites for the program, if you're still in Math 114, for example, and you think you're going to test out of that class, then make sure you do that before the summer semester, okay? Because if you have not tested out of that class, you have to take it in person. And so if you don't take it in the summer semester, if you wait to test out in the summer and you don't make it, you don't start the program, okay? So don't make yourself not start the program for a 1-hour class, okay? So make sure you meet those prerequisites. That's another way, okay? So we have a cost sheet in here. So you can kind of see approximately how much the program will cost you. And so you can kind of gauge what kind of costs may be coming up. So some of the papers that you have to turn in for the program. The first one is a release of liability for exposure to hepatitis B. Hepatitis B is a bloodborne pathogen that affects the liver and can cause liver damage, cancer, some problems with that. A lot of you may have received the vaccine when you were a child, when you were an infant, and so that's fine. You don't need this form, okay? If you have not received the vaccine already and you don't want it, that is perfectly okay. You just sign the form. You have a witness signature as well. Somebody witness you sign it, and you turn the form in. Okay, it's not required. It's recommended, but this one is not required. Released by parent, guardian, or spouse. So if you are under the age of 21, you have to have a parent sign this. If you are married, you have a spouse sign this. This lets people know that you are going to be off campus taken care of. Sick people, you're going to be exposed to illnesses. So they're all aware of that, your family or your spouse. So they sign this and you have somebody witness it. So you cannot witness your spouse or your parent signing it. You have to have somebody else witness them and do that. Okay. If you're over the age of 21 and you're not married, then you sign at the bottom. Okay. If a form has a witness signature or a line for witness signature, we need it witnessed. Okay. We'll give it back to you if you don't have a witness. Okay, because we can't do that. So a friend can witness it. You can witness things for your friends. You know, yeah, okay. Photo release form. We sometimes take pictures if we're actually on campus again, ever. We take photos often during classes and clinicals. We use them as promotional material in brochures or posters or whatever. If you don't want your picture taken, that's perfectly fine. You just mark decline and just let us know when we come around that you don't want your picture taken. That's okay. The release of liability is for you, so you're aware of the fact that you're going to be off campus and be exposed to injuries and diseases and stuff and illnesses. So you're aware of all that. So you have to sign and witness that one. Okay, great. The release of information doesn't happen very often anymore. But occasionally I have people who call me that want a reference for you, or it's usually prospective employers who want some kind of information. And this allows me to talk to them basically about that. The release of additional information happens even less often. That just is more for people if someone on campus, another instructor calls me and they have concern and stuff about how you're doing in a class or personal issues or something that they know about, that they call me. This is usually not an issue. This rarely ever happens. That just allows me to talk to other people. Social media conduct. Privacy and confidentiality is extremely important in the nursing profession. So you can't post anything on social media that would have anything to do with your patients or your clinical experiences or something. If you post something like, my first clinical day was really great, that's okay. But you don't want to say you took care of this wonderful 98-year-old patient who had a hip fracture at Alton Memorial Hospital, and that's people can track who that is and can figure out who that is. So you don't want to share any kind of information like that. No pictures of your patients or where anything clinical that could be even remotely attached to a person. Okay, so just don't post any of that stuff on social media. That is a violation of privacy and can result in dismissal from the program. That's a big deal. Hopefully we'll get to be on campus, and we're hoping in the fall that we'll get to be face-to-face classes. So if you get in our classrooms, you'll see that each desk has a computer. Okay. You cannot download anything on the computers. You can't play games on the computer. Class time is class time. We expect you paying attention and not playing games, not seeing what's on sale at Target. Don't change the computer settings. No food or drinks in the classroom. You turn them on and off, they stay on. I think that has pretty much it. The off-campus learning experience. This is so you know that you're not going to be on campus all the time. Your car will be parked other places, community sites, hospitals, whatever. It also lets you know that sometimes in clinical agencies, I have to send them more personal information about you to get into their computer systems and to chart and things like that. I have to share information about your student IDs and things like that. Okay, I don't do that unless I absolutely have to for clinical placements. But sometimes I have to share that kind of information, so I do send that to the hospital if I have to. Your drug screening and things like that. So this lets you know that. The substance abuse policy is probably a big surprise to y'all that you can't sell, dispense, manufacture illegal drugs at any time. You can't be under the effects of alcohol or illegal drugs while you're in class, lab, or clinic. Okay. Recreation. We know that recreational marijuana is legal in Illinois if you're over the age of 21. However, our clinical agencies have a zero tolerance policy on marijuana. So if you test positive and you get your drug test done and you test positive for marijuana, that's maybe legal for you to use it, but you will not be able to attend a clinical agency. I'll have no clinical spot for you. If you can't go to clinical, if I have no clinical spot for you, you can't complete the course because the clinical is tied to the course, so you won't be able to enter the program. Okay, so just so you're aware of that you have to have a negative drug screen for the program. Sheila, are you on yet?
I'm here.
Okay. So Ms. Emmerich is going to talk about the health forms.
Oh, okay. Perfect timing, or have you been waiting on me?
No, we just got to it.
Okay. So I was looking for a student because their name changed. So guys, don't change your name while you're in the middle of the semester. Just kidding. Okay. So these health forms here are for the family health clinic, and they are stapled together. And you will complete these health forms and complete them, take them with you when you go to your appointment for if you do a physical there or your TB, but definitely when you go do your drug screen, because you have to do your drug screen. I guess I could do a video. Sorry about that. You have to do your drug screen at the family health clinic on campus. So these forms are stapled together, keep them stapled, take them with you, and they will keep these forms. These do not come back to me. So make sure that they stay there, which they will keep them, and take these forms to the health clinic when you do your drug screen. And it's a couple pages worth. Plus, in this packet is your release for your drug screen results. And you're releasing them to send the drug screen results to the nursing program. And they come through secured fax. So that's what this whole packet is about. So make sure you take those with you when you go do your drug screen. Okay. Di. Thank you. All right, now this packet, there's two things. There's this guideline, which is attached to the LC physical form, health examination form. Those two things are going to go with you when you go have your physical done, and you have to have a physical to get into the program. So make sure you take these two things, and the physical form will come back to me. You will have to turn that in when you turn in your packet, and I'll go over that in a minute. But the things that you need is an MMR, varicella, tetanus, TB, and hepatitis B. So these immunizations, vaccinations, that's easier to say, you can get from a pediatrician, your doctor that you have now. If you cannot find your vaccination records, then you can always usually go back to your high school, because you had to have these turned in when you went to high school. They probably about 90% of the high schools still have them somewhere. They will get that information to you. So make sure that you have this information when you go do your physical. So when you're at your physical, then you can show your healthcare provider what you have, and then they can discuss with you what you need. So let's go over these. An MMR, it's a 2-dose, and it's for the measles, mumps, and rubella. And you should have had 2 doses probably when you were younger. A varicella, it's 2 doses, and that is your chicken pox. And you have to show that you are immune. So that is 2 doses of that varicella. Years ago, they never even had the vaccination. And then in the mid to late 90s, they only gave 1. And then, I don't know, probably in recent years, they started giving 2. So if you're in any of those categories, you have to make sure you have 2 doses. You cannot write down that you've had one or that you had the chickenpox when you were 3 years old, or you had them in 1991. You can't write that down. You have to have proof that you've had the varicella vaccination. Tetanus. Tetanus is a 10-year vaccination, but to get into this program, you have to show that you've had a Tdap, which is your tetanus, diphtheria, and pertussis. And that is also good for 10 years. So if you had that, and a tetanus and it's due, a Tdap and it's due again, you can just get the regular tetanus. You don't have to get the Tdap again. If you got a tetanus probably maybe 6 or 7 years ago and your 10 years is not up, you can go ahead and get the Tdap, because you have to show that you've had a Tdap to get into the program. So you can go ahead and get those early. That is perfectly fine. So make sure you talk to your healthcare provider about that. The TB requirement is a 2-step that you have to get into the program. So a 2-step is, a 1-step is you have the test, and 48 hours to 72 hours, you have it read. Those 2 times that you go to the doctor is 1 step. So you have to repeat that to make it be your 2nd step. And you repeat it within 7 to 21 days. A lot of students get confused and they think 2-step is getting the test and getting it read. Well, that's just 1 step. So it takes 2 times to make 1 step. So you're going to go to the doctor 4 times to do your TB requirement. Now, if you choose not to do that, you can do, there's 3 tests, and I can't remember the 3rd one, but there's 2, a quantiferin or the T-spot, and that's where they draw your blood and they test it. If you do that, then you'll have to do it 1 time, but I think they are more expensive. So you would have to check and see if your insurance would cover that. If you cannot have the TB, or you've had TB, or you've had a positive TB in the past, then you can do a chest x-ray. And with that chest x-ray, it's good for 2 years for the program, as long as it's a negative chest x-ray. Now, if you would happen to sit out a semester for whatever reason that you do, then you will have to repeat it, because then you'll be past your 2 years when that 2 years is up. The hepatitis B, I'm sure Dr. Banovic already went over this. You don't have to have it, but it is a 3-series vaccination. So you have 1, a month later, you have your 2nd, and then 6 months from your 1st, you have your 3rd. Or you can sign the form that says that you don't want to have it. Now, with all of these, if you cannot find your vaccination record and you don't want to have the boosters or go through the vaccinations again, you can do what's called a titer, and they can test your blood. They'll draw your blood and test it. And then if you have either positive or negative results, depending on what it would fall into the category for these vaccinations, then you have to turn in those results. And some people, just for an example, for varicella, they have never had the vaccinations, but they know that they had varicella when they were like 5, and they said they recovered from head to toe. But they go ahead and have the titer ran to prove that they are negative, and they come back, or prove that they're positive, but they come back negative. And so they have to go ahead and have the 2 vaccinations for varicella. So that does happen sometimes, but not always. And I'm not sure why. You would have to talk to your healthcare provider about that. So in a nutshell, these are the vaccinations that you have to start the program. Call your high schools, call your doctors, get this information in hand, and then have it when you go to your healthcare provider to have your physical done. And that way they can help you decide what vaccinations you need and what you don't need. Now, they showed you a checklist earlier, and it tells you everything you need. You need all this stuff, and you need all your release papers that Dr. Vanovic went through with you. They're going to go through CPR, insurance, background check, drug screen. All of that stuff has to be done and turned in by, and I had it written down yesterday and I don't have it now, August 9th, I think it is. So make sure you go through that checklist. I have this, I have this, I have this, and you turn everything in a complete packet. And make sure your name is on everything. It's all either stapled together, clipped together, or put in a folder, envelope, or something. That way everything is together. I prefer everything as one packet because I do this for 5 programs, which is over 300 students. So when you send me one thing and then another thing and 2 things here, it just gets real confusing, a lot of emails and stuff. So they went over it before. You can mail it to me. You can scan it and attach it as an email. Do not take a picture of something and attach it. Make sure it's a scan, and you can use like Cam Scanner, and there's different scanning apps for your phone. You can make sure you do that, or you can bring it to my office. And my office is in the nursing building, and I'm on the top floor within the center stairwell. So as soon as you come into the building from the parking lot, there'll be a stairwell right there. Come up those stairs, turn left, and there's my office. If I am not there, there's a mailbox to the left of my doors. You can put all your stuff in the mailbox, and I will get it, and I will send you all an email letting you know that what I got, and then let you know if you're missing anything, and then we can kind of go from there. The flu shot, it is not due till October. That is the only thing we do not want you to turn in early, because we don't want you doing your flu shot in like June, July, August, or early September. So your instructors will remind you, but you will have to have a flu shot to continue with the program. If you don't have your vaccinations, and if you don't turn in your transcripts, and you don't do everything you're supposed to do, then you won't be able to go to clinical. And we don't want these to be the issue as to why you can't go to clinical. So make sure you get this stuff done and you get it turned in. Before I continue, does anybody have any questions about any of the vaccinations that you have to do? Okay, all right, good. So on the health form, you will put your name on the health form. So make sure you do that. And then you're going to complete the health history. And then your healthcare provider will complete the physical examination, and they will, if they want to, write all the information on the vaccination history and your TB. And make sure within the examination history that they check mark that little paragraph to the right that states that you are able to perform the duties of a student nurse. So that's one of the reasons why you're going there. So they have to make sure that they complete that and do that check mark there. If they don't want to write down your vaccination history on this form, that's okay. As long as you have it printed out, then you can just attach it to it and turn it in, and that's fine too. A lot of people, like Alt Memorial is really good. They print out a really nice sheet if you happen to work there that has all your vaccination records. So make sure that you get that either from your employer, your doctors, your high schools, or however, or if you want to redo your vaccinations, that's fine too, if you need to. I would suggest doing it the cheapest way that you can. Do it with your health insurance if you have it. discuss it with your healthcare provider, find out what you need and how the best way would go about that. If you go to our clinic, they know exactly what we need. So that's a very good place to start. But if you have your own healthcare provider, or, you know, you can go to Walgreens or the Madison or any kind of county health department or anything like that, and they can do all this for you. Let's see, your CPR, make sure you take the correct CPR class. They'll go over this with you in a minute. There's a form or sheet in your packet. A lot of students, and we had 2 this last semester, that took the wrong course and they had to take it again, and it is expensive. So make sure you know what you're taking. It's the BLS, Basic Life Support for Healthcare Providers. So make sure you know what you're taking and do not take the incorrect class. If you had taken it, let's say your 2 years is going to be up in October of 21, for instance. So, or even, yeah, so you're starting in the fall. So if your TB or your BLS is going to be up in, say, October, November, September, one of those months, you know, within the fall semester, you are going to have to get that stuff renewed before you start the fall semester, because we have to have everything turned in, and Dr. Banovic has to be able to go to your clinical sites and tell them that we comply to their rules. So this whole packet that you have to do is not because we want you to do it. It's because of our accreditation states that we have to abide by the rules, and all of the clinical facilities require that you have all of this done and before you even step foot on their campus. So that's why we're pretty kind of gruff about you guys making sure you get it done and get it done in time. So don't forget to do that. Yours expires in September of 22. So that'll be part of your 4 years. So what it is we want it done and good for the entire semester. So if you're here for fall of 22, then yes, you will have to have it completed before you come back in the fall. And I know a lot of hospitals will do the CPR and do your TB for free. But then you can go and you can tell them, hey, I'm in the nursing program, I have to have this ahead of time, can I go ahead and get my stuff ahead of time? And most of them will work with you and get that taken care of for you. If they don't, then, you know, we apologize for that, but you will have to go off on your own and get it taken care of before you start the program. And then if you have to have it renewed anytime, it has to be renewed before you come in either the spring semester or the fall semester, whenever it is that you have to have yours completed. Does everybody understand that?
Yeah, I have a question about that.
Okay.
So my CPR expires next year, but I just started at OSF and they do like every 3 months I have to do CPR training with them. Should I just turn that in when I get done to you guys? So I don't think it ever expires then.
Dr. Banovic, what do you think about that? I mean, because the card usually says it expires in 2 years. So you don't ever do it once every 2 years?
No, they have like a training simulation thing set up to where we go down every 3 months and do it.
This is OSF or Alt Memorial?
OSF.
Also, so I would turn in like one that you have, and you probably wouldn't need. Well, this is interesting. So do you get any kind of card?
I have one now, but I'm not sure. I can ask and then send you an email later on.
Okay.
Yeah, because if you have a card now, that's even good to like September. What moon is good?
Mine expires next year in October.
Next year, yeah. So you can turn that one in at least, and then we can go from that. At least get you through
Okay.
this semester, and then we'll figure out how to do that. I don't know how they. That sounds good, great for the hospital to do that, but how do we prove that you got CPR? So, yeah,
Okay.
so, okay.
Okay. Yeah. So just turn the one you have in now, and then we'll come fall, we'll discuss what you need to do.
Okay.
Okay. It's the BLS, Basic Life Support for Healthcare Workers. And there is a information sheet in your packet that Dr. Banovic will go over in just a minute with you. So anything else? Okay. Let me see. I do not need a copy of your driver's license. A lot of times people send me copies of their driver's license. I don't need that, but I do need a copy of your medical insurance. And if you don't have medical insurance, you will have to get it before you start the program. And I know they're going to have an information sheet on that in your packet, or they'll discuss it with you. I need a copy of your insurance information. And you don't have to, I've had a lot of people like, you know, because it's small, they'll cut it and hand me this like itty bitty piece of paper. Just make a copy of it and leave it on the 8.5 by 11. That's perfectly fine. Let's see, let me look at my notes, make sure I have anything. We cannot do copies for you in the nursing building. You can do copies in the library. I think that's the only thing that's really open right now. So I suggest that you do make copies of everything that you have. One thing is, in case it doesn't make it to me, and I'll give you a little example of that, or excuse me, if I would misplace something, I can quickly call you up and you go, hey, I got a copy of it. Here it is. That's fine. And you're also going to need this information when you start your job as an RN. So make copies of everything, keep it in a safe place, because you're going to need this information in 2 years if you don't already need it for where you work right now. But this semester, I had a student who sent it to me by mail and plenty of time to get to me, like 2 or 3 weeks ahead of time. It never got here. So luckily she had copies of everything. So she reproduced her packet, gave me another set of copies. And then I think it was just last week or the week before, which would have been about the 4th week of the semester, her packet came. So that's one reason why we want you to make sure you make a copy of everything. You do have to turn in an activity fee. That is $25, and that's on your checklist also. It is either check or cash, because we can't do credit card or debit card or anything. And so make sure you do that. And you can make it out to LCCC if it's a check. And then we do give you receipt for that. Let's see. Witnesses. I know Dr. Banovic went over this with you, but it happens every semester. On the forms, there's not very many forms that need a witness, but the ones that do need a witness, you have to have somebody watch you sign it, then they sign that they saw you sign it. They have to be 18 years or older to do that. And then the one that's a parent, guardian, or spouse, if you have a parent, guardian, or spouse sign it, then you cannot be their witness. And they cannot be their own witness. Someone else has to be their witness and sign it. So you have to make sure you have someone with you other than them when you actually do that. And I had those issues this semester too. So make sure that you do that. Let's see. A due date, you guys do not wait to the last minute. Everything is due by August 9th. We don't really want you to do your drug screen, your CPR, or your TB until after May 17th, because that is when, that way you'll have it covered through the entire spring semester next time. But today, tomorrow, I know it's kind of late today, start looking for your vaccination records, call the clinic, get your appointment for your drug screen for sure, get your appointment if you're going to use them to do your health exam, your physical, because like I told you, I take care of 5 programs, plus there's other programs on the campus that uses the health clinic that also have to have drug screens and physicals. So make sure that you contact them early, because they can only get so many students in at a time with COVID restrictions. So make sure that you get your appointment. Do not wait till the week before, 2 weeks before to do this, because especially if you do the TB, it takes time. It takes, at least 21 days to get that stuff taken care of. Don't wait till the last minute. And I know emergencies happen. People get sick, cars break down, you have to work. But if you start now and get your appointment set and get yourself ready, then you're not going to have that issue. So don't wait till the end and then come up with an excuse to me saying, someone was sick, someone passed away, unfortunately, or, my car broke down, because I've heard every excuse that there really, really is. But so make sure that you take care of this, get your appointments, and put it in your phone, in your calendar, so you have this information. Okay, I've been seeing some, let's see. Do you have the number? I do. I think it's right here at the very bottom. Sherry has it up. It's 618-468-6800.
Yeah, it's in the paper you have in your packet.
Yeah. And someone still hasn't received their packet. It's probably in the mail, just like that one student's packet. Mail is super slow these days with COVID. I do know for a fact if mail goes through the Bridgeton or the Hazelwood mail center in St. Louis, it sits there for weeks on end before it comes out. I've had packages sit over there. So that's why we want you to get stuff turned in, or, you know, be on top of it. Oh, okay. Make sure, you know, you get that. So you'll probably get your packet. Diane, I don't know, when did you mail those out?
They went out a couple weeks ago at least.
Yeah. So I would say, yeah.
Like after I sent out their acceptance letters, the packets went out. So, why don't, so you guys who haven't received yours, I've had probably 3 or 4 people. Let's give it till the middle of next week. Okay. And see if they arrive. If they have not by that time, email me and I'll send you out a new one. Okay. Because yeah, I think things are just taking so long for some reason. So let's try that. Just email me by the middle of next week if you haven't received it. And also if I go by the card of intent when I mail out anything to you guys, because that's usually more current than maybe what's even in the system, because sometimes students move and forget to change it with the college. So I go by the card of intent. If you have moved or had a change of address since that time, please send me that information also, and I'll resend your packet to that new address. Okay, does that make sense to everybody? We'll just give it a few more days and see if you get it. Okay, thanks.
Yeah. So one more thing I want to tell you, if you go to the family health clinic to do anything other than the drug screen, they do not send me your health records because you have not signed a release that tells them to do that, which you won't because they're not going to anyways. It's your responsibility that if you go for a flu shot, a TB or physical or anything, you make sure you get a copy from them, make a copy for yourself and send me the original, or I can have a copy. It doesn't make any difference. But the clinic will not, even though they're on campus, they are not the nursing program. They are the clinic. They're a whole different entity. So make sure that you bring me everything except for the drug screen. That will come to me through secured fax. Now, I don't need your receipt for the drug screen. I don't need your receipt for the background check because the background check I do, same thing, it's secure. I get that information also. So those are the only 2 things that you do not have to turn in. The rest of the stuff you have to turn in. So make sure you get on top of it, get it taken care of, because when it comes first semester, that first day, if you don't have it, they are going to be on you like you wouldn't believe. So we want it done so you can concentrate on your studies. You don't have to worry about this. So let's just make sure we get on it. If anybody has any questions, email me. That's probably the best way, especially with COVID right now and working from home quite often. So make sure that you email me and I'll get back to you with any questions. I'd rather you do that and ask me all kinds of questions, or if you want me to look at something to see if that's what you really need, I can do that too. So don't hesitate to give me a call so we can get this stuff taken care of. Okay, I think I covered it. Did I cover everything? I can't hear you. Can't hear you, Diane.
Nicole, now can you hear me?
Yep.
Okay. Nicole wants to know if the varicella vaccine is a live virus.
I think it is.
Okay.
So if you're getting the COVID-19 vaccination, you're going to have to work with your healthcare providers and figure out when you can have some of these. Because I know we had a lot of people who went ahead and got the COVID vaccination and couldn't get either the varicella or the TB or something. I'm not quite sure which it is. And that's fine. You just have to let us know. But you've got a lot of time. You've got several months to get this stuff taken care of. So you should be able to work it all in before August. So that's another reason why you don't want to wait till the last minute to start doing this stuff, because then all of a sudden you can't have vaccinations on top of vaccination. Just make sure you talk to your healthcare provider.
The COVID vaccination is not going to be required because, yeah, I don't know about supplies and stuff. It's a great idea if you can get it. It would be really good, but it won't be required.
Dr. Vanvik?
I think you got everything. I don't remember anything you didn't cover.
No, her question.
Which question?
Nicole's last question.
Oh, I'm sorry, I didn't see it.
That's okay.
See Nicole's last question. I don't see it.
She's diabetic and she can't have live viruses.
I would talk to her healthcare provider about that. I didn't know that it was a restriction from diabetes. I thought you could have live virus vaccinations. So
if there's a reason that you can't have it, then we would need a statement from your healthcare provider stating that information, and then Dr. Banovic will take a look at it, and then she'll, a decision will be made from there.
For example, people have medical reactions to, flu shots or whatever. There's a medical reason why they cannot have it, and then you just provide documentation to us, and then that's fine.
Right.
Mm-hmm.
Okay. Anything else? Okay. Well, I'm gonna get back off, and good luck to everybody. And again, don't hesitate to email me if you needed anything. Okay. Thank you.
Thanks, Sheila.
Uh-huh.
Yeah, thank
Bye.
you. Bye.
Hi, Sheila.
Bye-bye.
Thank you.
So I have a paper up on the screen about the Family Health Clinic. So that is the clinic on campus in Phillips Hall. It is open to the community. It's open from 8 to 4:30, Monday through Friday. You can get your flu shot over there. You can get your school exam and the TB skin test. All those things can be done over there. This is also open if you got a sinus infection or a cold or something you want to be seen. If you have family members who need health care, who need to be seen for high blood pressure or cholesterol or whatever it is, they can be seen over there as well. It's pretty inexpensive. So if you don't have health care, that can be an option for you. They do blood work over there. So, if you have family members who need health care, that's someplace to check out. And the number is down there on the bottom, 468-6800. Put this paper in here just so you don't need a dental exam to start the program, but just so you know that we have a dental program on campus, and they have a clinic, and so that you can get all exams, x-rays, and preventive services for only $28. So if you or a member of your family needs some dental care, some cleanings or something, you can call there and make an appointment. So. Parking permit registration. If you do not have a parking permit, a hang tag, then you need to get one. So you stop at the security shack at the north end of the campus and make sure this is what they'll give you to fill out. Okay, and they'll give you a hang tag. So the background check. You have to have a background check to start the program. Okay, so you need an email and a credit card. You go into the website, www.verifystudents.com. Okay, and there'll be a button, students start here. You fill that out, that shows you the nursing instructional code, or the promotional code, and they'll answer some questions about where you live, your married names, maiden names, those kind of things. It'll be $66 for that to be done. Okay, and then those results come directly to us. Okay. She had talked about CPR. So we have 3 papers in here about different places that people have used CPR. Sometimes we have classes on campus, but I don't think we have any scheduled. Do we, Diane?
I don't think.
Look? Yeah. I haven't seen any scheduled. So your work may do it for you, or if you need somebody else to do it for you, there's these places that know what we need and can take care of that for you. Okay, so we're looking for a healthcare provider CPR. Okay, so anything that you would do for healthcare professionals is what you want. So this is Andrea. There's a company called Compressions. They can take care of it for you, help you, Doug and Tom. And there's another company there. So there's some options for you. Sometimes you can get together with a group and fill it out and schedule a class. Let's see, a couple questions.
I don't see anything.
Okay.
You guys, honestly, don't hesitate if you have any questions at all. You don't have to be so quiet.
Yeah, Nicole, I'll talk to you about it later, okay? And I'll answer her question.
I do have a question.
Sure.
I don't think I fully understand or understood her. Do I need to renew? I was the one that my CPR expires September 2022, and so I have to keep it up with my work. And they just renewed it. Can I renew it like later on, or does it have to be renewed before I start?
So you can use that card as you have now. What will happen is you will need, so let's see, so you'll be fall 21, so summer 22, you'll have to renew it during that time before the semester starts in the fall.
Okay, perfect. Thank you.
Yeah, yeah. So hopefully they can fit you in somewhere at work, you know, or something, get you in.
Yeah,
Done.
they make sure all that's good.
Yeah, yeah.
Yeah, so just to be clear, so anytime, you know, you have something that expires during the middle of a semester, whatever semester it is, you know, whether it's in March in the spring semester, October in the fall semester, you just have to have those completed before the semester begins, okay? As an example, if you have TB that's going to expire in March of 2021, where you're going to have to get that a little sooner than your normal due date and have that ready before classes start in January. Okay, same with fall. If you have something that would expire in October, you're going to have to do it a little sooner so that we have all your records up to date by the time school starts in August. That way we don't have, you know, 250 students having a million different expiration dates that everyone has to keep track of. It's so much easier when it's all done. The faculty don't have to worry about it. We don't have to worry about it. More importantly, you don't have to worry about it, you know, hanging over your head when you're trying to get your studies done and going to class and clinicals and everything. So that's the reasoning behind it.
So you want to check, Aaron, probably at work, because at work they're going to say, well, you're good till September. They might not schedule you early, so you might just have to talk to them about, I need to take it in July or whatever. So you're done. You know.
Okay, thank you.
Depends how they schedule their CPR.
Yeah.
So I think Clayton had a question about, yes, you do have to go to the clinic for your drug test. I know sometimes you get drug tests done for work and things like that, but you do have to use our clinic for drug tests. Okay. So there's some information from the policy and procedure manual that I just want to go over before you start the program. So there's certain technical standards that you have to perform. You have to be able to function as a nurse. So there's certain dexterity, physical, visual, mental, you know, auditory things that you have to be able to do to work as a nurse. So if there's any questions about you being able to do any of those things, then you might need to talk to me about that. We may need to make some kind of accommodations, or maybe we can't make those accommodations. We need to discuss that. So, and you'll find out some of those things also too when you go to your physical. You know, they have certified that you're able to do the duties of a student nurse. Smoking is prohibited on campus properties, so campus and clinical sites. So you cannot smoke on campus or clinical sites. So if you smoke now, it's probably a good time to quit. We already talked about alcohol and drugs. There's zero tolerance policy on that. And we talked about medical marijuana. So If you have any issues with that, then we need to talk about that. But if you're test positive for any drugs, then you cannot go to clinical spots. Profanity cannot be used when in class lab or clinical. And I consider that very much a professional issue. You're in a professional program now, and I expect you to behave as such. So you can't use that kind of language. You know, to anybody, whether your instructors or your other students. Okay. Confidentiality, we already talked about. Cell phone use is really limited in class and clinical. Okay. A lot of the clinical agencies will not let you have a cell phone with you at all. So you have to leave it in a locker room or a locker or something like that. So some people don't even bring it in the hospital at all. So just so you're aware of that. So the uniform information. We wear navy blue scrub pants, white scrub shirt, V-neck scrub shirt, and navy blue scrub jacket. The scrub jacket is the plain old button-up, snap-up kind of scrub jackets, not the fancy tracksuit looking jacket with a zipper or anything shiny. It's plain old basic zipper button-up one. There's a school patch that you can get in the bookstore, and it's on the left of her sleeve. You get two of them. It's on the left of her sleeve of the scrub shirt and the navy blue jacket. Okay. Now these are just basic scrub pants too, as well. They're not fancy. Granny's Uniform Shop in Upper Alton knows what we want. She stocks uniforms, so you can go there. You can find navy scrubs other places like Farm and Home and Walmart and wherever you go, and that's perfectly fine. Okay, they just have to be plain, no designs or anything on them.
So they basically just have to be navy blue scrub pants and a white scrub top.
Yes, navy blue scrub pants and white top. Closed white leather shoes. Something that you can wipe off, basically. Okay, they can be tennis shoes or they can be nursing shoes. It doesn't matter. No Crocs or clogs. Some hospitals don't allow that, so we're trying to say no for everybody. Okay, there has to be something that you can wipe off. If you spill something on your shoes, you should be able to wipe it out. You don't want it to soak into your shoes. Okay, so no mesh or anything like that, or cloth. And then it shows you some other things that you need. And I think Granny stocks all that stuff. If you wear a shirt under your uniform, and that's fine. Some people do for comfort. That's fine. It has to be plain white. Same length as the scrub top. It shouldn't hang down way lower than the scrub top. You want just plain white. You want anything on the front of it that you can see through the scrub top. The pants will fit. They're going to feel funny to you. Okay, they fit higher up on the waist than you're used to. You're used to probably lower riding pants that fit more on the hip. These are going to fit up a little bit higher, so they're going to feel weird. But that's how they're supposed to be. Don't roll them down so that you're dragging on the floor behind you. Or if you bend over, you're uncovered. Okay, you have to make sure that's all. You're all covered up. Make sure your top fits that when you lean over, you don't see cleavage there. If you have issues with that, you might wear the shirt underneath.
As Dawn would say, make sure your uniform fits your body and not your ego.
Yeah, there you go.
I always like that one.
Your hair has to be up and off the collar. So you don't want, if you're leaning over a patient, you don't want it to fall forward, okay? Because you don't want the patient's face or the patient's wounds or things like that. That's an infection control hazard. So, rubber band or barrette, simple barrette can pull your hair back. Some people like headbands, and that's okay if you navy blue, black, or white, something kind of plain. Your hair has to be a naturally occurring hair color. Don't dye your hair blue right before class starts, because I'm going to tell you you're going to change it. Okay. Nails should be a safe length, clean, manicured. Only clear shades of polish may be used. No artificial nails. That has a lot to do with safety and infection control as well. You don't want to scratch patients. You don't want gunk under your fingernails. There's all kinds of to that. No fake eyelashes. Cleanliness is important due to your contact with the patients. You're going in and working with sick patients. So please take a shower, use soap. Don't use a lot of colognes or perfumes. That's usually too much for patients, okay? If you do smoke and you come to clinical and you want to get in on the smoking you can on your way to clinical and you bring a cigarette, your instructors are going to talk to you, okay? So keep that in mind, that smoking in a closed car on your way to clinical is going to make you smell like a cigarette, okay? So keep that in mind. And instructors have had to talk to students about some of these issues and they're not pleasant. So, try to keep in mind to take a shower and, use deodorant.
Nicole has a question.
Oh, yeah, you can use makeup. That's fine. Your makeup is okay. Just don't lay down for like a night out in the town. It's not a club scene. But yeah, appropriate makeup is perfectly fine.
Tattoos have to be covered, yes.
Oh, yeah. Nope, I was going to go down the page. Excessive jewelry is not allowed, one stud earring per lobe, and that's because people pull on it or things like that. So no hanging earrings, wedding band, just one ring. Tattoos are covered. No gum chewing in clinical, because what happens is sometimes people are chomping their gum. Okay.
And you only have to cover your tattoos for clinicals, not for class.
So can we wear like a long sleeve shirt under?
Yes.
Okay.
Yeah, that's fine. And a lot of people do that, to cover up. Okay, Diane, would you show the Perkins, please?
Sure. So in your packet, you'll find this sheet, and it's about the Perkins Grant. The Perkins Grant is federal funds that's available to college students. So read through here. You definitely want to take advantage of this if you feel that it applies to you. What it does is it pays on the back side of the sheet. It tells you what it'll pay for, such as they'll supply you with your uniform, tennis shoes, a watch, some other things as well. Guys, so Clayton, you're automatically eligible as a minority in nursing. So you automatically qualify for this free stuff. So good for you. And also, if you receive financial aid, you're eligible. WIOA, some type of public assistance. If you are a single parent, so you can, like I said, I'm not going to read all of them to you, but you can read through them, see if they apply to you. If they do, there's phone numbers on the back side of the sheet. You will contact Alice Bungeon and she will verify your eligibility. And then she'll probably hook you up with Jane Fleming, who will get the items for you. Do not buy the items before you check with them. If you think you're eligible, don't buy them first because they cannot reimburse. But like I said, definitely notify them if you think you're eligible and take advantage of those federal funds. And then I think we have SNAP next. Again, some benefits that you might be eligible for. You could be eligible for SNAP or Link card benefits. So read through that. And if you feel like you're eligible, you can contact Angela Weaver. She's a director in the financial aid department, and she can assist you with those funds as well. I can talk about this too if you want me to. So as we discussed earlier, you guys do have to have insurance for the nursing program. Our clinical facilities require it. So if you do not have health insurance for yourself or through your family or anything, this company has nothing to do with Lewis and Clark College. We simply make students aware of it because they have some good plans, some good cheap plans. So they have plans for, like, if you're young, you're healthy, for like, just for minimal service for like $25, $35 a month. So it's pretty inexpensive. If you need something like this or you're interested in looking at it, send me an email. I'm the same person you emailed to accept your position in the program. So you probably have my email address somewhere, or you can write it down. It's right here. So you can let me know. I will send you an electronic copy of this, and you can look through it and check the prices and stuff and see if it's something you might be interested in. And that's one of the things you'll turn into with your packet, is a copy of your proof of insurance.
So if you're covered on somebody else's policy, your mom, dad, spouse, whatever, we just need a copy of that insurance card. That's fine.
And just make
So-
sure it has your name on it.
So any questions about any of the stuff we discussed? I know we give you a whole lot of information.
I have a question regarding jewelry. I have gauges in my ears. Do I need to get rid of those?
The engages have to go, yeah.
It's a safety thing for you.
So I will schedule you for nursing classes. Okay, if there's any other classes that you want to take with your first semester, if you need A&P 1, 2, micro, whatever class you want to take, you will schedule those, get on your self-service or however it is you schedule, and schedule those classes. Pick whichever course you want, sign up for those, and I will work around those. Okay, I can work around school schedules. I cannot work around work or babysitting schedules or anything like that. There's just too many students for me to be able to do that. But I can work around school schedules, okay? So to let you know, the 170 course, and you can see on there, is on Monday to Friday mornings, 8 to 9:50. So don't schedule anything during that time. 171 and 160, I have multiple options and I can work around those. I divide you up till you're relatively evenly divided between the classes. So schedule, if you want any other classes to schedule for the fall, do that right the Friday before spring break, okay? Because then I will pull your schedules and work around those, okay? There's something else I was thinking I was gonna say. Oh, leave a day open for clinical. Your clinical will be either Tuesday, Wednesday, or Thursday, so you have to leave your morning open for clinical, okay? Don't schedule all your other classes in there, and don't leave yourself a morning for clinical. We'll have to move your schedule. So keep in mind that either Tuesday, Wednesday, or Thursday morning has to be open so I can schedule clinical.
Does everyone know how to schedule themselves? Have you done that before? Online on the Lewis and Clark website? No? Okay, I'll kind of show you how here. Sherry, you want me to talk about this?
Yeah.
Give you a break. So if you go to Lewis and Clark's homepage, the pictures and stuff may be a little different now. I scanned this, I don't know, a year or so ago. So if you go to Lewis and Clark's homepage, lc.edu, and you'll go to schedule of classes search, and the wording may be slightly different now, but you'll get it. When you click on that, it takes you to your self-service. So you can look up your course. Let's just say, for example, you need to take A&P 1. Then you're going to enter biology in that subject line. And then that'll take you to a different screen, and where it kind of filters down. Like here, you can select the semester you're looking for. So you're probably going to look at summer 21, fall 21, whatever you're going to register for. And then it will see the circle where it says view available sections for biology 130. You'll click on that and that'll give you all the different offerings for that particular course. Okay. And then you'll look and see which one works best for you and your schedule. Again, you're going to leave a Tuesday, Wednesday, or Thursday morning open to allow for clinicals. You will also sign in and you use your BlazerNet account. Okay, if you don't know your BlazerNet account, you can contact the help desk at 468-4357 or 468-HELP, and they can help you get that set up. If you've never done this and you're not even sure what your login information is, contact them and they will help you with that. So then once you pick one, it'll allow you, I think it says add to your schedule or something. I apologize, I'm not real familiar with this because I never have to use it, but I think it's pretty user friendly. And if you do have problems, if you see a course you want, but you're not sure how to register for it, you can always contact the enrollment center. And their number is 468-2222. And they can help you get signed up for classes too. Okay. And then like Dr. Banovic said, once you guys do that, register for the other classes you need besides your nursing classes, such as your AMPs, micro, sociology, speech, English, any of those that you need. She will schedule those two other sections, the nurse 160 and 171, around these classes that you schedule yourself for. Does that make sense to everyone? I know it's kind of confusing.
And keep in mind, biology classes usually have a lab, so there'll be more information. There's a class and a lab section.
Yeah, when you click on the actual course, you can kind of drill down and it'll tell you the lecture times and the lab times for those classes. Sometimes it doesn't always show up on the screen unless you click on it. So in the 170, that's your core course. That's the one on Mondays and Fridays. And that's the one you're all going to be together. You'll all be in lecture class together in there, hopefully by fall. And then the 160 and 171s, those are smaller. Those are smaller sections. And we have a number of sections for those. And that's what Dr. Banovic will put you in. Like she said, she tries to divide everyone evenly. Now, we know some people aren't always happy because everybody wants to try to get in all their classes on the same day, and that's just impossible. We can't get everyone on a Monday, Friday schedule to go along with your 170 class. So some people are going to have to come in on Tuesday or Wednesday or both for their other classes, okay? And I know it's not the perfect schedule, but there's just no way we can get everybody in on the same days. So we do our best to try to make your schedule as user-friendly as we can, but you may have to come several days for class.
For clinicals, does it change every week or is there a set day that they'll be on?
There's usually a set day. So you'll be assigned Wednesdays for the whole semester is how it works, especially in first semester. It's Wednesdays for the whole semester. And Meredith had a question. You usually find out about a month before the semester starts. It's usually, but they have clinical placements. Sometimes it's a little more in the summer. They have a little more time. But it's usually around a month before. So.
Can you request a day? I know you said you don't work with childcare situations, but is there a way to like request a day that would work best for you? Or
usually not. I've had people who've said that before, and what I tell people is we can't guarantee it. I mean, you could say, gee, I'd really love to have a Thursday clinical, but there'd be absolutely no guarantee that you could get it. So, I mean, you could email that, but need that information.
There's just entirely too many students to try to, accommodate every individual schedule. There's just no way of doing that.
And you said
And
the
that-
clinic,
Go ahead.
and it's
Sorry,
6
Erin.
hours. No, you're fine. It's 6 hours the first semester. Is that what I
Yes.
heard?
Credit,
Okay.
credit wise. A 6 hour,
No.
6 hour clinical day, yes, okay, I'm following you now. Yeah, 6 hour clinical
Yeah.
day,
So- okay.
yes. Yeah, I'm with you now,
And they
Erin.
usually start what at like 6:30, 5:30, 6:30 in the morning, something like
Usually
that.
6:30 they start usually,
Early.
yeah.
Rest up, people.
Okay.
Yeah, and some of you have taken all your prereqs, and which is great, and focus strictly on the nursing classes. I know some of you are finishing up your prereqs this semester and in the summer, and that's fantastic. So, so hopefully everyone will, if they need classes, we'll get them in by the Friday before spring break, and then we'll know when we print everybody that if we don't see any classes for you, we're going to assume that you're done. You don't have any other classes to take. Does anybody have any questions about any of that?
So we don't have to worry about scheduling any of our nursing classes with any outside sources.
Correct. We'll take care of that. And it'll be a little while, keep in mind, because I'm gonna wait until, I'm gonna give you till spring break to have people schedule their classes. So it's gonna be a few weeks before you guys know what classes, 160, 171 you're in. So,
And once we get that information, once you do your part and Dr. Bandovic does her part, she'll email the enrollment center with the 3 classes, your nurse 170, 171, and 160, and say, enroll the following students, all of you guys in those classes. And as soon as the enrollment center gets you entered, then you'll be able to see your exact schedule. But that's going to be a few weeks out yet. But just check BlazerNet periodically or self-service for your complete schedules. I wish I would have thought of this yesterday. If you guys have any restrictions on your account, like a parking ticket, a tuition, you have a tuition payment due, just anything where you might have a restriction on your account, make sure that's taken care of. Otherwise, you will not be able to register for anything, and we won't be able to register you for anything. And then what can happen is you may not get into the course that you want because they'll fill up. College allows health science students, which is you guys, to register prior to everyone else. So you kind of get an advantage there as far as, trying to get into the A&Ps, micro, the popular courses. So yeah, just make sure everything with your account is good so you guys can get into those and, try to get a schedule that works well for you.
any other questions?
Anyone?
Need a viewer. So and you may not right now, but you're going to look at this information and you go through it and you may say, now what did they say about this? And, just email us, let us know, because we know this information like, the back of our hand. We deal with it all the time. But you might be confused about some of it, and that's perfectly okay. We understand that. So just let us know, what you have questions about, and we'll help you with it. Okay, feel free to do that.
May I just verify the first semester timings just one more time with you? So it's
Sure.
Mondays, Wednesdays, and Fridays starting at like 6:30 in the morning for the 6 hours. Do we ever go on Tuesdays on the first semester, or is that only the second semester?
Okay, the 170 course is Monday and Friday mornings, just 8 to 9:50. That's the 170 class. The Tuesday, Wednesday, and Thursday would be possibly a clinical day. One of those days will be a clinical day. Okay.
All right, thank you. That's what I have written down.
That's okay. I know it's kind of confusing, and because I throw all these other things at you,
I
now
have a lot of background noise
the
too.
160 and 171 course, those are either Monday afternoon or Tuesday. So it's possible you could go on a Tuesday.
Yeah, so that's fine. Thank you.
You're welcome.
I have a question. There's no summer classes, right?
That is correct.
Okay.
Okay, if no other questions,
Councilman?
Nicole, stay on. I'll talk to you about that issue. And if you're done, you have no questions, then we're done.
Thank you.
Thanks,
Thank
guys.
you. Thanks.
Thank you.
Congratulations.
Thank
Thank
you.
you.
Thanks. Bye.
Bye, guys.
Bye. Thanks, Diane.
Bye, thank you.
You're welcome.
Hi, I just wanted to apologize. I was late.
Oh, that's okay, Carrie. Cameron?
Yeah, yes.
Okay.
I just wanted to make sure like my name was wrote down, like if I was like taking attendance and stuff.
Oh, email Diane McDonough.
Email her and let her know.
Yeah, and let her know that you were there. She would be the one who's keeping the roster, the list of who's on. So she
Okay.
want to make you make sure she knows.
Okay, thank you.
Okay, you're welcome, Cameron.
Bye.
Okay, Nicole, do you have access to somebody who has a credit card?
My mom does.
Okay, would she can you pay her and use her card?
Most likely, yeah.
Okay. I don't know if they would take like a prepaid card. They might if you bought a prepaid card, but then they will require some kind of card.
Okay.
So, but if you want, you can try that, buy a Visa prepaid card and see if that works.
Okay.
Okay.
All right.
All right. Let me know if you have any questions or any problems. Okay.
Thank you.
You're welcome.